Hey, I know you may have questions about what is called Part B penalties. If you are enrolling into Medicare A and Medicare Part B, in any situation, you really want to understand what exactly happens to me if I don't enroll in my Part B, because there's going to be a Part B premium I'm going to be paying. I may not enroll into it. Exactly what penalty is going to be assessed to me if I do not enroll until a later time period. What are the rules and regulations around that? We're going to be talking about that today in today's video. Stick around, I'll be right back. Are you getting penalized for not enrolling into Part B when you become eligible to enroll into Part B? My name is Kelby Hightower with Medicare Hub. I'm going to walk you through exactly what you need to know and understanding the penalties and what happens to you when you become eligible for Part B and you turn that down and you wait till a later period of time. We're going to walk you through a few minutes here in just a second, a few minutes of overview exactly how Part B works, the penalties, and then when can you enroll. There's actually a time period that eliminates you from having coverage for a long period of time that you need to be aware of if you're choosing to turn down your Medicare Part B options. So if you want Medicare coverage to start when your job-based health insurance ends, you need to sign up 3 months prior is what we tell people. Sign up for your Part B 3 months before. That eliminates you from having to worry about some of the benefits and coverage. So second thing, what are credible coverage rules that apply to you? So a person must not be without credible coverage for 63 days or more in a row anytime after they were first eligible for Medicare drug coverage to not be charged a late enrollment penalty. So sometimes people think I'm coming off credible coverage or an employer-based plan. It's been 63 days and then you haven't done anything for your Part B, and then all of a sudden you hear about, oh, I need to enroll in my Part B, and you may have heard somebody say you're going to be penalized for not having your Part B. They may be talking about Part D as in drug benefit. After 63 days of lapse of coverage, there's actually a penalty that you're assessed for that. So we have a whole nother video that talks about the penalty of that called Part 1 of this series. You can actually walk and it talks to you and walks you right through the penalties assessed if you don't have a drug coverage. But Part B is different. You actually have 8 months time period when you come off credible coverage from an employer plan. You have an 8-month window to enroll into Part B. So I've got great news if you're confused about all of it. You can actually grab our guidebook that costs you nothing to walk you through the steps of how to enroll into Medicare. It gives you scenarios and your situation may be plugged into one of those scenarios. If not, guess what? Even better news. You can actually call us. We'll link you up with one of our licensed insurance agents that specialize in Medicare health plans to answer your questions and walk you through the steps. We actually can fill out the documentation for your 40B, your L564, and all the documentation that your employer needs, that Social Security needs, that Medicare needs. Send that in for you and actually handhold you through the process so you're not getting confused and getting lost in the paperwork and eliminating yourself the opportunity to enroll without being penalized. So let's jump on into the next thing that's very important. Step 3 is, what is the 8th month rule for Medicare? Well, earlier I said that to you. This rule applies to those that are coming off an employer-based plan. You have 8 months to enroll into your Medicare Part B. Again, 3 months prior, 63 days after. That time period is going to always eliminate you from any penalty. We always say enroll into Medicare A and B 3 months prior to your effective dates of when you want your Part A and Part B to start. Or if you're already on Part A and you want your Part B to start, then you would enroll 3 months prior. And then we're going to have time enough to walk you through, or you're going to have time enough to enroll into a Medicare health plan effective the day after your employer-based plan stops. As I like to say, there's no lapse in coverage when you do it that way. If you have questions, you can always ask us or reach out. If not, we're going to jump into this 4th thing that's important to remember. What if I miss my window? So this is big because it happens, and I've had clients over the years, and I do not want you to experience this as well. They miss their window. They miss the 8 months. They're told that they don't need their Part B, or they say, I don't want to pay the Part B premium. It's expensive. I'm not going to pay it. And then all of a sudden they go to the doctor or they go to a specialist and they're billed the full allocated amount. The specialist charges $300. You get a bill. You're like, oh my gosh, why am I having to pay this? And you call in, you say, I have Medicare. And they say, well, you have Medicare Part A. Part A covers the hospital. Part B is going to cover the medical, your primary care, your specialist, your diagnostics. your therapies. It's going to cover all these, a list of things under Part B of Medicare. And now all of a sudden your specialist sends you a bill and you're left holding the bag for paying for that bill. And then you call someone like us and you say, hey, I didn't enroll in my Medicare Part B because of the premium, but I've got doctor's appointments allocated or scheduled for all this year because I have a procedure that's coming up, and I'm having to see my primary care, I'm having to see a specialist, I'm having to see an orthopedic, I'm getting prepared for the surgery, I've got an outpatient surgery coming up, what's it going to cost me? And all of a sudden you begin to stress out, or what I like to say, you freak out in a healthy way. So what's going to happen to you if you missed your window, this 8-month window, or when you were eligible for Medicare at 65, you weren't working, you didn't have credible coverage, and you just turned your Medicare Part B down? What happens to you? Well, guess what? There's this window called the General Election Period. It's from January 1st to March the 31st. You actually have to wait to that window of time, enroll into your Medicare Part B, and have that. It's going to start July 1st. So if you're in the middle of the year and you're in July of one year and you realize I should have enrolled into my Medicare Part B January 1st, or you turned 65 and it was February the 15th was your birth date, your Medicare A and B should have went effective February the 1st, but you turned your Part B down. Now all of a sudden you're in July and you're in what I call up the creek without a paddle, and you're trying to figure out, what am I going to do? That's going to be a question that you have with the specialist saying, I made a determination to turn down my Part B. I made a mistake. Is there any way we can push some of this stuff out, or can I do a cash pay? But if you're in an emergency situation, you're really up the creek without a paddle. So you're having to wait to this January to March the 31st, and then your Part B coverage is going to start July 1st, which means 3 months prior to that July 1st is when you would actually enroll into your health plan. So if you're choosing to enroll into potentially a Medicare supplement, if you can qualify for that, or a Medicare Advantage plan, you would do from July 1st when your A and B is, or your B is going to go into effect. So you'll have Part A, Part B, and it allows you to enroll into a health plan. Then you're enrolling into a Medicare Advantage plan. That plan needs to be scheduled 3 months prior. Talk to someone like us. Let us walk you through which plan is going to be the best fit for you. And then your enrollment for that plan is not going to start until July 1st. This is called the General Election Period. And it's very important just to remember not to get yourself in that situation, to ask questions from a licensed professional like us that can eliminate you from getting yourself into that situation and eliminate you from having the proper coverage that you need. So we suggest starting the process, 3 months. That's right, 3 months prior to major health plan changes, whatever your situation may be, or 3 months prior to you turning 65 if you're not on an employer-based plan, you're self-employed, you're retired already, and you're looking at your health plan options. Always ask questions 3 months prior up to 6 months. 6 months you can't really do anything, but at 3 months the paperwork and all this process can begin. The 8-month rule guide, something that we have been giving out to a lot of people. One is how to enroll into Medicare. That guidebook is going to be below, but also this thing called the 8-month rule guide. That's going to apply for you guys that have been on an employer-based plan past the age of 65. What are your options for enrolling into Medicare Part B? What does that look like? How does it work? We have a guidebook below. It's a simple, just one pager that gives you some information. It's very important for you. And also, guys, before I close, if you have not really got a deep dive into Medicare, you have all kinds of questions. Maybe I stirred up a lot of emotions inside of you. Now you've got 20 questions. I would encourage you guys to enroll into our Medicare Made Simple workshop. It's a free workshop. It's an on-demand. That just means you're going to get an email with a link that you click on, and you can start the workshop at your leisure, late at night, early in the morning, during the day. You also get a guidebook. So you have a guidebook that you can open up. You can print it out, open it up on your phone, your computer, your iPad. You can print it out if you want. You follow along the videos, and we have this process that we call watch, listen, and apply. So you can watch it, listen, take notes, and then you'll know how to apply your next steps on choosing the right health plan for you. So we go over all the basics of Medicare, A and B. We also go into the deep dives of Medicare Advantage, Medicare supplements, prescription drug plans, all the different moving parts of Medicare to simplify that. And we wrap that up in a bow in about 40 minutes of a workshop that we provide to you, so you don't have to leave the comfort of your home. You can actually see the workshop and everything that you need to know there in your PJs with a bucket full of popcorn, your guidebook, and a video. So if you guys have additional questions, reach out to us. If not, take advantage of all the resources we're providing. We'll see you on the other side, and have a great day.